Hello and welcome back to Bedside Murmurs, a podcast where we chat to doctors about their careers, pathway of medicine, clinical tips, and much more. If you have any questions or any ideas for guests you would like to see on the show, shoot us an email at podcast@medsoc.org.au. That's podcast@medsoc.org.au. I'm Sean.
And I'm Emily, and we will be your hosts. Today, we are very excited to welcome the lovely Joyce El-Haddad, who is a lecturer in anatomy and histology in the medicine and health faculty at UNSW. Joyce is currently pursuing her PhD revolving around medical ethics, with a particular focus on informed consent and the use of fetal and embryological remains. Joyce's outstanding contributions to teaching have been recognised through numerous nominations for teaching awards, and she actually has received the New Teacher Award and the Award for Teaching Excellence from the School of Medical Sciences at UNSW. Her commitment to engaging with students and the general public has been demonstrated through her active presence on social media at Orientate with Joyce and through collaborations aimed at increasing health literacy using social media platforms. Welcome to Bedside Murmurs, Joyce.
Thank you so much for having me.
It's so lovely to have you on. So we'd like to get to know a little bit more about you. Mm-hmm. What did you originally study?
I studied a Bachelor of Medical Science at Macquarie University in Sydney, and then I pursued a Masters of Research also in Macquarie University.
Okay. So what did you originally want to pursue with your degree, and how has this changed over time?
Yeah, so in school, I wanted to be an optometrist because I was the only one in my biology class who dissected the eye properly. And my sister
That's
took
the
me
inspiration always.
Yeah, right. And you know, my sister took me to open day at UNSW, and then the first thing that I thought, this uni is really far away. I'm not going to do that. So I opted for something a little bit more general. So I started with medical science, and I did anatomy, and then I realized, hey, the eye is the worst part of the body. Or my least favorite rather. And yeah, I guess from there it just flourished.
What did you not like about the eye?
That's a good question. I think it's not so much what I didn't like about the eye. It's
that you love the others more.
Yeah, how much I loved the other stuff. I was like, no, there's more to the body than the eye and the vitreous humour and the aqueous humour. That does make complete sense. Yeah.
Oh, I thought it was really funny because like eye is one of the really strange structures where it's like it's if you look at it in isolation, it's just like a water balloon, but truly. Everything else has like all these really interesting insertions, and I was like, I did wonder like where the shift came.
It's okay. We do love optometrists and
no, of course, respect to the eyes, not just to the eyes. I mean, I love seeing. So
vision is good. We just had a discussion about whether you had the eyeglasses on or off.
Exactly.
And so you went to UNSW Open Day, thought it was too far away. Yeah. What happened after that?
And then I just changed my preferences on UWAC. Okay. And I put medical science first at Macquarie University. And and then I got in and I was like, great, let's do it. Yeah. Yeah,
fair enough.
Yeah.
Do the course you got into.
Yeah, like not a lot of thought went into what I wanted to do after high school, to be honest. I knew that I wanted to work with people. Yeah.
I do find that interesting though, especially when you think about like wanting to work with people and then choosing a very research-based degree. Where did you transition from like I want to work with people to like research is my way of reaching people? Yeah,
so I guess my career path is more so higher education and teaching students anatomy and a little bit of medical education as well. And the research part of my career path is more so how I can progress in my medical educator role. Yeah. I definitely am not a traditional research scientist. Like I don't work in a specific lab pipetting or anything like that.
I cannot imagine in a lab pipetting the entire day away.
It more so complements my teaching and it informs my teaching. Yeah. So the people part, I guess, comes from you guys, the students.
So could you explain to our audience what a medical educator is and what the day in a life looks like for you as a medical educator?
All right, get ready with me as I...
GRWM.
So a medical educator is basically someone who teaches medical students. So I got into this role by first teaching anatomy at Macquarie University and a little bit of physiology as well. And then when I transitioned jobs from Macquarie to UNSW had a medical program, as you guys are aware. And, you know, that my teaching is now beyond anatomy. It's still very heavily based in anatomy, but, you know, now I facilitate in SGs, I contribute to the medical curriculum and so forth. So, and I bring my ethics expertise into different facets of the program as well. Yeah. So a day in the life of a medical educator. So today, for example, I had a histology lecture on connective tissue. And then I came to uni, facilitated in BDGA. We talked about newborn screening, which was really interesting. And then, you know, a couple of meetings here and there, especially around the medical redesign program. So I'm representing ethics on the anatomy side of things, but also the surgery side of things, which is really interesting.
I do want to ask a little bit about that. During the course redesign, purely depending on how much you're able to and willing to reveal, what is the kind of focus for the redesign? Do you want to focus more on, like, essentially from our perspective, anatomy has always been a little bit daunting, especially when we're getting assessed on it.
Yep.
I heard, like, you know, the practical exam is getting more in person, and there's talks of it perhaps going back into the original, like, flags in cadavers kind of idea. What, in the course redesign, what will the focus be more within? And from an ethical perspective, what kind of considerations do you have to think about when you're redesigning a course?
Yeah, so that's a really good question. I guess what we go off by is feedback from the experts in the field, feedback from the students, and feedback, you know, of what we experience in the anatomy teaching. What we know is that students want more anatomy. They want to go through anatomy a little bit more thoroughly and a little bit more systematically rather than like bits and pieces here and there. So that's something that we are advocating for. And in terms of the ethics part, I guess for me, what I'm trying to advocate for is to, you know, I think this is controversial in like the ethics realm, but I think it's important to differentiate between legalities and ethics. I think, you know, they're very intimately intertwined, but they're very different. I feel like it's very easy to dismiss ethics by saying, oh, well, is it legal or is it not?
Yeah.
Rather than it being something that we can, you know, truly inspire our way of thinking and our line of thinking and have it more so as a reflex, like, okay, I'm going to adopt this framework, this is the reason why, but then how else can I justify this, or how else can this be counted, and what is the best decision for whatever patient outcome is in question.
So it seems that you quite enjoy anatomy. Would that be correct? Would I be correct in saying that's your favourite discipline, or are there other contenders for that title?
I mean, it has to be anatomy, right? But anatomy, I think, like, is, you know, very biased here, but it is the cornerstone of medicine. Your patients are anatomy,
100%.
right?
Yeah.
And I think anatomy, I don't even think of it as a discipline. I think of it as like a way of thinking and a mindset. You know, knowing where something is one thing, but knowing how it works, what works around it, and what happens when it doesn't work, and what happens when things around it don't work. You know, that's the basis of pathology and so forth. But I think anatomy is very closely linked with things like radiology and surgical anatomy, and they're disciplines that I really appreciate, and I always want to understand a little bit deeper as well.
I think from a medical student perspective, since we're trying to get and become doctors, especially the people that are kind of very more internal medicine leaning, from an internal medicine perspective, you can kind of treat the patient as a big bucket of water. And you just like
blood tests you want.
like,
Get the radiologist to look at the
you
reports.
can kind of just go like, I'm gonna put this drug in and see what happens.
Yeah.
And you can kind of treat like a human being like a homogenous thing.
Yeah.
And slowly, as you get through medical school, you get to a greater understanding of how anatomy leads to just
100%.
Everything else, and just you can't diagnose without anatomy.
No.
You can't practice medicine at all without having a basic understanding of where
Facts.
things are. And you don't know where things are, you can't.
Totally.
You can't do anything else.
Totally. And, you know, anatomy, I think we should clarify, it's beyond just the internal organs, right? It's the outside. It's the surface anatomy. It's knowing where to palpate a specific organ. It's knowing what levels to insert a cannula at, and so forth. And even your skin, it tells you a story of what's happening inside. And if we don't know that, then we are putting our patients at a disadvantage. Yeah. And I think, you know, in internal medicine, the whole philosophy of treating someone like a bucket of water, this is also what we want to change in anatomy. And we're so lucky that we have our body donors in the lab to kind of remind us of the human behind the human anatomy. Yeah. So, we should always remember that there's a person behind this bucket of water and whatever. And I think anatomy is like that first step in truly understanding that and truly instilling that in students, which I hope we do.
This is going to be a very interesting question. And it basically goes along the lines of, especially when people in cadaver labs and we're looking at a human being and we're kind of dissecting them in a way that seems very clinical. It seems very focused on just like just all the pathology and things like that. And it reminded me of a story I heard from one of my friends from overseas. And essentially what was one of the anatomy teachers had sadly passed away and donated her body for vivisection, which I thought was a wild thing to do. How do we maintain like the human consciousness and like having that humanity and essentially ethical reasoning and respect for the body when we are essentially learning from them in like such an intimate way?
Yeah. I think, when people donate their bodies to medical education, I think they are very aware that they are giving back to the medical education side of things and ultimately and more broadly giving back to medicine. Most people donate their bodies because they've either had a really good experience in the medical field and they feel the need to want to give back. Some other reasons include, they don't have family, so they don't know what to do, after death. Or they don't know what needs to be done with their body after death, so they opt in for this option. Or some people, the funeral costs and can be quite expensive and can be quite a heavy financial burden. But most of body donation comes from like that altruistic side of things. Can I ask what country that was from?
Taiwan.
Yeah. Okay. So my Masters of Research was around commemorating our body donors, and Taiwan actually came up as a country where people truly, like communities in Taiwan, truly understood the importance of donating their bodies to medical education and so forth. So they were really comfortable with the level of respect shown by students. That even educators would donate their own bodies to the facility that they taught at because they trusted that their students would treat them with respect. I think for us, what we can do to make sure that we are being respectful, we are like truly grateful for the anatomical gift that's in front of us. I think learning from the bodies and truly learning, like genuinely learning from them and, not always remembering like, I wonder if they did this or I wonder if they did that. That's nice to do sometimes. But if you truly learn from them and you truly embody that anatomical gift and you take that gift and you make the most out of it, then I think that is the most important pillar of respect and ethical conduct.
Yeah, the greatest form of respect is to learn as much from their donation as possible.
Yeah, absolutely.
As they intended for their body to be used.
Exactly, yeah.
This, I guess, is similar to what your PhD is about, the use of donor specimens and things like that. Could you expand on what your PhD is revolving around and how, I guess, your experiences as an anatomy lecturer has informed that?
So my PhD initially started as a PhD on congenital heart disease, but I had to change that because during COVID, it was really impossible for me to collect data. So we changed it to another discipline that I really like, which is ethics. And I started with a literature review, basically looking at what fetal collections exist in the literature. And the main finding from that literature review was that all of the fetal collections that were present in the literature, we know anecdotally that they exist in very large numbers, but the ones published in the literature, all of their remains were obtained without informed consent. And they were also, some of them were gifted by obstetricians to embryologists to research on and to collaborate with research on. So there are several reasons why informed consent was not obtained. So most of them, the collections were established prior to the era of informed consent, which was around the 1950s, 60s. And other reasons were just complete disregard of the next of kin, so the mother that carried the fetus or the embryo. which I think does not align with the way that society works now and the ethics of society and what society actually expects from us. So this kind of led down to some studies where I surveyed Australian stakeholders, so stakeholders meaning like medical educators, students, technical staff in the lab and medical professionals about their perceptions towards these collections. And one of the most recurring theme that kept coming up with these this first study was how important informed consent was to people and how much people valued informed consent, which seems really obvious. But, you know, I think when we have that data telling us that people value informed consent, these collections weren't obtained with informed consent. What should we do with them? And how should we get informed consent now from people who do want to donate fetuses or embryos that were either aborted or miscarried? So this then led to further studies where kind of like a shifting or a turning point of the PhD where it kind of, we started to use the fetal collections as a vehicle to have conversations about informed consent and really explore different constructs of informed consent, what ethical framework they align with. And then now, you know, towards the end of the PhD, what I'm doing now is just putting all of my data together to kind of, you know, establish guidelines, number one, for what we should do with fetal collections, particularly those ones that weren't obtained with informed consent, how we should get informed consent for potentially new collections and if there's actually a need for it, and then talking about informed consent itself and how it's evolved throughout time and what we can anticipate to change with informed consent as, you know, as society becomes more aware of their rights, more aware of how important informed consent is. Yeah.
Yeah, that's very well summarized. An entire PhD thesis.
Thank you so much.
In a minute thesis.
I'll take the PhD now.
Yeah. It's such a shame that you don't get to like actually defend it like as like a oral thing because you would have done amazingly.
Yeah, but would it defend me? That's the that's the question.
That obviously sounds like a whole lot of effort and a whole lot of time spent into researching the topic. I think there's a few of us within the medical community as well who, and also people who are watching from like medical science or even just like trying to get into medicine that might also be considering a PhD. There's often also like this kind of confusion with like, is a medical degree a PhD? No, it's not. It's slightly different things. I think it would probably best come from you. What would you say the difference is between like a PhD and basically any other university course?
Yeah, that's a really good question. So a PhD is what new knowledge can I contribute to the world? What are the knowledge gaps in the world right now? And what am I passionate about what gap am I passionate about filling? Whereas any other degree that's not research-based, like medicine or most of medicine, is what knowledge exists and how can I learn all of this knowledge that exists. But I think most importantly, it's learning how can I learn to learn this knowledge and how can I continue to learn this knowledge. And I think that would go for any other coursework-based degrees, but any other research degrees is mainly about contributing knowledge rather than learning knowledge. But then in contributing knowledge, you learn. Yeah.
So
it never stops.
Yeah. So would it be similar to having like a normal, most degrees is an acknowledgement of your capacity to understand and I guess consolidate the knowledge within that course, and a PhD is a recognition of your contribution to that specific area of your course.
Yeah, absolutely.
That sounds
but I think the end product of any degree should be I finished this, whether I've learnt knowledge or contributed to knowledge, and now I am a lifelong learner and I will continue to be.
Yeah.
I think when we are university students, once we are no longer university students, we become students of the universe. That's how I think of it.
Yeah. Oh wow. Oh, that's really well said.
El-Haddad,
that's gonna be clipped. Yeah, like that is really interesting. I think that there's some people who kind of see degrees as like the end goal, where like the graduation is like, oh, I've completed. It's like this is gonna sound so brain rot, but have you seen the real where it's like, oh, I just finished all my homework. I don't know what I learned, but I'm done learning.
Unfortunately, I have.
And I think it's almost sometimes it feels as though like finishing a PhD, especially because of how like kind of prestigious it becomes. Like you become like a doctor, which sounds really, really cool. It's like a doctorate, and then you're like a doctor, which is like a teacher essentially.
Yeah.
It seems as though that's like the end of your educational journey, which is clearly not the case.
No, the more I progress throughout my PhD, and the more I continue to progress, the more I feel like I don't know anything, and I feel like I've just started.
You've went over the Dunning-Kruger curve.
Truly. Yeah.
That's always a cause for celebration, if anything.
Yeah, but I mean, there's just I think when you again with the PhD, like contributing knowledge and whatever, when you see how many gaps there are in our understanding of not just like pure knowledge, but understanding of the human experience, I think for me anyway, it motivates me to just continue. And I'm not sure that I'll ever stop unless something happens to my vision. Then I'll
this is all going back to optometry. We've gone full circle.
But there are ways to do that too, right?
Yeah.
And how do you think that your PhD will contribute, I guess, to medical education for like medical students? Do you think that is an area that's quite relevant?
Not heavily, not directly anyway, but I think there are facets of it that can contribute to medical education, particularly in the way that we teach ethics, and 100%. Particularly the way that we teach informed consent. So one of the things that I found with my PhD is that there are 3 types of informed consent. First one is the blanket traditional informed consent, like, do I have your permission or do I have your consent to do this examination and so forth. Then we have broad consent and dynamic consent. Broad consent is more so research-based, and broad consent is when someone or a participant or a patient consents to something where the objectives are not yet known. So this obviously comes with a lot of scrutiny, particularly with the rise of like unanticipated technologies like AI and so forth. So then now there's like this new line of thinking and this new construct that we call dynamic consent. And this is where we constantly engage with the patient and the participant to get their consent about anything that is different from the original conditions of the agreement. So I think there's room to definitely implement those, particularly in fields like surgery, and other disciplines where there's heavy involvement with the patient. And I think also the physical use of fetal collections and the use of anything else that tapers on the concepts of death and dying are very highly relevant to medical students. I think one of the things that came up in one of my focus group studies was that people, particularly medical professionals, they felt really strongly about this, and they felt that fetal collections can offer medical students a safe environment to have whatever reaction they need to, so that when they are in the clinical environment where they witness something like a stillbirth or something along those lines, that the main focus is shifted to the patient and the care of the patient in question, so that you've seen what you needed to see in the labs or, at university. You've had your reaction, and any reaction is fine, right? As long as it's not at the expense of whatever donor we're looking at. And then, as we use that experience to prepare you for clinical practice so that you don't have that initial reaction. And, when you have an initial reaction about anything, it's usually quite uncontrolled sometimes. And, we're all human at the end of the day. So I think we can use that to kind of prepare you for clinical practice. And, I guess that's the main implementation I see.
I mean, I would say that your PhD is very relevant to medical students. I think
great.
I agree.
I think just understanding the ethical constructs about what it actually means to have informed consent and what it actually means to be utilizing anatomy in a respectful and just relevant way. Yeah. And I think also, in addition to fetal collections, just being around our body donors, I think when we conduct ourselves in such a respectful way and an ethical way, it gives us a platform to advocate for those who don't have a voice. And that's what you will also do with your patients, and you will advocate for them at tables where they don't sit.
I can't help but make parallels to this and the conversation around sexual consent as well. It sounds awfully similar and familiar.
Yeah.
A lot of the things like dynamic consent, also just the concept is very, very similar to that kind of thing. Do you see lots of alignment between the two, and has one learned from the other in certain ways?
I definitely see a lot of alignment. I haven't explored, the particular like inspiration from one or the other, but I think the concept of like the different constructs of informed consent would feed into things like sexual consent and the age of consent. So one of the things that I've come across is assent versus consent. So assent is the consent capacity for a minor. And this is mainly to do with like clinical examinations or participation in research. So I think, things like consent capacity, consent literacy, overall literacy of like comprehension skills and whatnot can also inform things like consent when it comes to legislation and legalities.
I guess it all comes down to like respecting our humanity and respecting other people and giving people the dignity and respect that they deserve.
Yeah,
whether
absolutely.
we're looking at fetal remains or whether we're interacting with our peers, I guess it's all coming down to the fact that we are all human.
Yeah, absolutely. Yeah. And it's all about respecting autonomy and upholding our obligation to do no harm, whether that starts in the anatomy classroom or whether that's like when you're a consultant.
Yeah. I want to ask a little bit about AI, just because you mentioned it.
Let's go. Let me get ChatGPT out.
Right now, immediately.
Yeah.
I guess just very open-endedly, what do you think about it? How will it affect your job? How will it affect the way you work? How will it affect the way you interact with it? Basically, just way you interact with it, and also the way you interact with other people who are using it as well.
Yeah, I love this question. Thank you so much. Look, I think when AI first came out, when did it come out? 2 years ago? 1 year ago? Something like that.
5 years ago.
Oh, okay.
Yeah. 2018, I think, or something like that.
Okay. Well, I became aware of it 2 years ago.
Okay. So did I.
Yeah. And I think so many people were apprehensive, particularly educators. They're like, this is the end of education. Like, oh my God, it's like, let's panic. But at the end of the day, it's about the person using the tool in front of them. And if we think about like what people were apprehensive about with AI, it was all about the unethical use of AI.
Yes.
So and I think I don't think this is realistic, but I think this is, this is the ideal situation. If we instill ethical principles in society, then there's no reason to fear how people will use AI. If we educate them on what's ethical and what's not, then there's no need to fear how people will use AI. But I think that's the unrealistic part, that we can't, unfortunately, we can't actually trust that will happen. But we can try our best, right? We can try our best to advocate for those who can't. And advocate for when we see something that isn't right happening with AI, like those deep fakes, for example, that we see, and like the unconsented use of people's voices, like particularly actors and whatever. They start with actors and artists and whatnot, but then they'll move on to just, the everyday person. So my line of thinking is that if we really hone down on the ethics of AI and the ethics of how we use AI, then I think we should be okay. How it affects my job, it makes my job easier. It particularly the admin side of things. Anything that I can do to make my process more efficient, particularly with admin, I will do, as long as there's no like breach of data or privacy that I'm putting into AI. But I think it's hard for educators who might not be like tech savvy. I'm not very tech savvy, but I'm like not that bad at it at the same time.
You're technologically literate.
Yeah, exactly, exactly. But I think that also brings up an issue of accessibility, like between like ChatGPT 3 or ChatGPT 4. If we want students to use it at a university level, should the university give students access to ChatGPT 4?
We should.
I agree, because it evens out the playing field.
You're 100%
and we don't want to keep holding back people who can't access certain things just because other people can. And I think that's one thing that I would like to see happen. I don't think we should be too scared of AI, and I don't think we should dismiss how much impact a human interaction can make, and can have, and worry about, AI is going to take my job, or AI is going to take over. just it's not that deep, I don't think, just yet.
Just next semester we'll be back.
Yeah. I don't know if I'm going to regret that.
But you do have a fantastic social media presence. What
Thank you.
inspired you to start this?
Yeah, so that's another good question. So in 2020, we all know what happened that year. But before COVID,
C word.
yeah, I'm sorry. I got my first full-time academic position at Macquarie University. Before that, I was a casual academic. And simultaneously, and I don't know if I should take this personally or not, all the people who taught anatomy at Macquarie University in my faculty left the university.
Oh.
I was like, oh,
Wow.
cool.
Fascinating.
Yeah. So then, there is a shortage of people who can teach anatomy, and particularly all of the disciplines.
Yeah.
So I was asked to step in
Yeah.
to convene all of the anatomy subjects and teach all of the anatomy
Wow.
That's a
content.
lot. Yeah.
That is a lot.
And I was like, I love teaching.
Yeah.
How hard
Sure.
can it be? And then, COVID happened. And in that first semester at Macquarie, I think I had about 1,300 students in different subjects.
Wow.
One subject had 900 students.
That's a lot.
Yeah, and I don't think I processed how many students I actually had.
Yeah.
But then when we went into lockdown, I was like, okay. And also I should mention that Macquarie didn't use Teams. We just used our Moodle-based platform to communicate with students. And I was like, oh, I don't like that. And I'm not sure that students are going to be checking what we called iLearn. So I was like, okay, what is a platform that I can reach my students at that they are familiar with and that I'm also familiar with? And that's Instagram. And I was like, okay, let's start an Instagram page.
Yeah.
Yeah, so it was basically a way to connect with my students and to maintain the rapport that I had with my previous students. So I was teaching postgrad students, for example, who I taught in undergrad. So I wanted to maintain a connection with them. But then I also wanted to build a rapport with my new students. There were 900 of them and I wasn't going to see them in person. So I'm like, I don't want that because, at the time I thought that I would be teaching them throughout their years too. And then I left Macquarie and I came to UNSW. And then I love that page because it's allowed me to stay connected with my previous students, and leaving my students was the most difficult part of transitioning from universities. But then it also helped me connect with my new students at UNSW, and then now I've connected with many other health professionals, many other educators, and we've started projects, we've started different collaborations, and I've learned so much just being on there, and I think it's a way to role model to students what a social media presence is on a professional level.
Yeah.
And I hope I do that. And I think, I'm really proud of that page and the community that it has.
I think you really should be.
Yeah.
It's such a fun and engaging platform.
Thank
and
you.
you can actually learn a lot.
Great.
Before my
Yeah.
exam, sometimes I'll just have a look at your saved folders and go, oh, okay, I'll have a look at those diagrams.
That's what those saves are.
Yeah.
So
okay,
good.
Great.
Yeah, 100%. Also, as a almost an aside, this is very similar. The story to Dr. Matt and Dr. Mike, how they started their YouTube channel.
Yeah.
Shout out to you guys. You should come on. There's an extra
Yeah.
mic waiting. There's an extra mic waiting.
There is.
So they were saying how they just uploaded the videos that they put on their SharePoint, I think, and just on YouTube, and more people than were in their class were watching the videos.
Yeah.
And it just kind of blew up from there. And it sounds like you had a fairly similar experience where you were just teaching what you were originally teaching.
Yeah.
But now, because of how well you're teaching it, people are finding an audience, and people who might have struggled with certain areas in their anatomy teaching are able to gravitate towards your page and learn the things and fill in the spot blanks that most people are struggling with.
Yeah.
And it's really interesting how the algorithm works, because the more useful something is to more people, the more it gets shared.
Yeah.
And that's such a great feedback loop. And as much as I don't really like technology in this, in the way social media kind of works.
Says a podcast host.
I don't like how social media works mentally
totally.
on a person, and I don't like the isolation that it strives to breed. But it does provide a platform where accounts like yours can grow to impact as many people as they deserve to.
Yeah. Thank you. That's very kind.
And
And your memes are actually funny.
Yeah, the memes are actually funny.
Yes. Put memes like medical memes, and you look at them and you go, "That's not it."
No, I know. Every time I go on like the real tab on my Orientate with Joyce page, I'm like, I'm cringing. This is not good.
Have you ever had friends and family get that pop up on their feed and send it to you?
Oh yeah.
Oh my god,
like,
you're truly Instagram famous now.
sighting.
Celebrity
As
status.
in like family on my page. Yeah, my mum follows me. My aunties follow me. And I have family overseas and they send it to my parents and they're like, oh my God. And my parents are like, yeah, we know.
And I think I do want to also say your page is like a masterclass in academic communication, because that's it's actually,
thank you so much.
It's really difficult to strike that balance. And I think especially it takes a certain type of integrity to be able to do it, especially on social media, because there's a wow factor. There is a certain type of like, if you say viral things, it will become viral.
Yeah.
And there's long lines of like medical educators who do the viral stunts and get lots of views, and often at the detriment of the information that they're doing. Can you tell us a little bit about like what the thought process behind making posts, what the thought process behind making content is, and like, is that things that you consciously consider when you create something, or is that like something that you just accumulated as you've learned to become a better educator, as you learn to present yourself in front of students?
Okay, so I think my page, when I look at it, I'm like, wow, there's no aesthetic on this page.
Really?
Yeah, like, you know when you...
That's news to me.
That's so funny, because your page is actually really aesthetic.
So nice.
Really?
Yes.
Oh, so you know those like influencers on Instagram, you go on their page and everything is like the same font, same color.
Yeah.
I'm not that person.
But that's boring.
Yeah, okay, good. Yeah, okay, so I find that really boring too. So I'm like, I don't want to do that. And I'm like, I want different colors. Like, I don't want one color. Why discriminate? So in terms of like the aesthetic side of things, I don't think about it. I'm just like, okay, what color do I like today?
Yeah.
You know?
Well, it's actually really smart. It's like what things would make it easiest for me to convey the information.
Yeah.
It doesn't matter about like my channel aesthetic.
No.
It's how do I put the information out the best?
And I think one thing that I've like come to terms with my page is that it is not a page that will go viral in any means, and I don't particularly care about that because if I impact my students and the community that I originally aimed to do, then that's enough for me. But I've started to notice that I'm starting to get people from the general public following who may not necessarily have a science background or a medical background, and I think it's changed the way. Like, it's changed what I post about. So I don't go through, like, the very technical details of anatomy in the first post. I will have, like, an introduction to something, and then I'll slowly build on it. And hopefully it works, particularly for, like, that kind of audience, the general public audience. The memes, to be honest, sometimes...
They just entertain yourself?
Yeah. No, sometimes I'll have difficulty falling asleep. And I'm like, oh my God, that is so funny. I'll make it. And I'm like, I can't post it now because it's not like peak posting time. So I'm like, I'll save that one.
Posted.
Yeah. And then the more educational posts, they usually align with what I'm teaching.
Yeah.
Or sometimes, you know, if I'm at a party or I'm out or whatever, I'll get like a question about the human body. I'm like, that's a good one. That's a good post idea. So I'll do that. Especially like when you gather, like when you have a family gathering at Christmas, like everyone has like a health issue that they bring up or something. They have a question about their body. And I'm like, good question. Yeah. Good question. Let me just let me put that in my notes.
You'll see it soon.
Yeah. I'm like, oh, that'll be a good post. And they're like, Joyce, I don't care about the post. Just tell me the answer. Yeah.
Yeah, that does make sense. I think it's almost like the best way to describe it is when you're like, you have that kind of medium and you're able to go and try to like educate the things that are commonly asked towards you.
Yeah.
You get the ability to understand what the general public actually needs to learn about.
Yeah.
And it's really interesting because one of the things that I think a lot of doctors struggle with is how do we communicate to patients about how do we communicate to patients about the disease they have?
Yeah.
How do we inherit the understanding that we have so that they can make the best decision for themselves. And there's one side of it where it's like doctors can just be better at communicating, but sometimes there's often limitations to that. The other side and the flip side of the coin, which you're helping a lot with, is how can we just raise the average education of everyone?
The health literacy,
of the general
understanding
public.
the human body.
And I think if they can tell you what they know and what they don't know and what like they think they know, I think that's really helpful for medical professionals to be like, okay, this is the level that I'm working with. Everyone starts at an intro level, right? Everyone starts at an intro level. It's about how you build it up. It's about how you explain it to someone and not get too bothered with all of the jargon and all of the different terms and so forth. Like that's really easy for me to say in anatomy when it's full of jargons, right? But we just need to, like the uterus, for example. An everyday person will think of it as the womb. So if that's a term that they're comfortable with, use that. It's okay not to use the term uterus. The only time I think I would correct someone is, let's say, like they were confused between an epinym and like another structure in the body, like the fallopian tubes versus like the pouch of Douglas or something.
The eponymous names is just
it's not helpful. It's not helpful. I mean, I'm not going to go on about pouch of Douglas because we won't finish. But I think that's one way to approach it. And also, if you know what they do for a living, for example, like let's say they're a construction worker, and they want to understand like how bone remodels or what's happening in osteoarthritis and so forth, you can use like the concrete example. Like you have cells, like this is one construction worker taking the concrete away, or like putting concrete and rebuilding this building or whatever. So I think if you get onto their level and their line of thinking, and then bring them up to your level of thinking, then I think that's the way to go.
Yeah.
And I guess what you said is true. Everyone does start at that baseline level and build up that knowledge. You use a lot of different teaching techniques in classes, like different drawings. We even had dancing in anatomy once.
Have I?
Yeah, 5, 6, 7, 8 for the cranial nerves.
I saw your stop motion.
Which one?
It was like there was a stop motion epithelium that I saw this morning.
No,
that was really cool.
Okay, but there's no dancing. Is there?
I remember you were telling us 5, 6, 7, 8 for the cranial nerves and the brainstem.
Okay, but I just want to clarify for the listeners. There's no dancing involved. But no, there was like the cranial nerves at the ponds.
Yeah,
the 5, 6, 7, 8. The countdown to start.
Yeah, that's how I remember them now.
Oh, lovely.
Yeah, I mean, what has inspired your teaching methods and how we actually teach anatomy?
It's how I learned. I needed to make it as funny as possible for me to stay interested. And I needed to make up all of these analogies to like really understand it. And what I used to do is when I used to live at home with my parents in undergrad, I would study something and then I'd be like, okay, Mum, I want to explain this to you. Tell me if you understand it. And she would. And I'd be like, yeah.
Nice.
Great. Yeah. And I use like that concrete analogy a lot, even though she wasn't a construction worker.
I think everyone, even like no matter what profession they're going through, has the same kind of process where where they start at like not knowing anything and then they get better. Yeah. It's like acknowledging that it's not that they're uneducated in medicine; they're just differently educated.
Exactly, and they have a different skill set. And one of the other things that inspired me to do this was my friends in undergrad relied on me to help them a lot and teach them through different subjects that we did. So we would hire out a library pod and we would have a whiteboard in front of us and we would just teach each other. And that was a really, and when you're learning with your friends and you're studying with your friends, you come up with like really silly analogies and really silly ways to think about it. That's what we would come up with.
Oh yeah.
What are your top tips for learning anatomy?
Orientate.
What do you mean by orientate?
Okay, good question. So orientating, okay, let's say we don't orientate. Let's say we open Google Maps up and we want to go to somewhere, but instead of looking at our starting point, we just zoom in on our location and we screenshot and like, yeah, that's where I want to go. Yeah. But you don't know like where to start. You don't know what road to take. You don't know what left or right turn to make and whatnot. That's orientating. We want to zoom out. We want to start as simply as possible. Even, let's say we want to identify the facial nerve, for example. We know that the facial nerve runs underneath the parotid gland, and we usually see it from a mid-sagittal view, or rather a lateral view of the face. the first thing that I'd get students to do is be like, okay, show me what you can see. Just let's start off with the really basics. Let's start off with the ear. Let's start off with the eye, the nose. And then from there, we build on that detail. Okay, what can we see next to the ear? We can see the parotid gland. We know that the parotid gland has a really intimate relationship with facial nerve. Where is the facial nerve in relation to parotid? It's under it. So can we see anything coming out from the parotid gland? So that's orientating. It's knowing the basics, and then it's finding that one point of reference and using that as your frame of reference to identify everything else. So orientating, of course, has to come with preparation. It's knowing, okay, we're going into the lab to look at cranial nerves, for example. So I need to know the relations of the cranial nerves. I need to know what's related to them. And if I know like three main structures to use as a frame of reference, then I will most likely manage in that lab to navigate a face, if you will. Yeah.
So the top tip is just orientate.
Just orientate.
Orientate? No, that's the main tip.
Oh, that's more.
Yeah.
Oh, good.
Please. So orientating is the first one. And preparation is key. You know, I think listening to your lectures and actually listening, not like, okay, looking, hearing what they're saying, writing it down, and then just passively forgetting everything after you finish from the lecture. So what I used to do is I used to print out the lecture notes, which I think most of you would just look at on your iPads. If you just skim through it, you don't even have to read it. Just skim through it the day before or an hour before and anticipate what they're going to say and what they already have on their slides. I would write down what my lecturers would say, but wasn't particularly on the slides. That information that they say, but it's not written on the slides, and I say this very loosely, I don't think is that important in terms of like what's going to be in the exam. But it's important in terms of getting a holistic understanding of that topic or the topic in question. So that's what I would do. I would write down everything that they said but wasn't in writing, and then I would leave it, then go to the prac, go to the tutorial, and then, you know, at the end of the week, I'd collate everything that I learned about that topic from all of the different classes, and then I would make my notes.
Yeah.
And then every week, I would revisit notes from week 1. Whether it was in week 7, I would go back to week 1, 2, 3, 4, 5, 6. And that's what I did for all subjects. But I only figured that out in second year. And I was like, yeah, that's much better.
This reminds me of when we had Fergus on, and he was like, one of the most important things to get through medical school is maybe look at the lecture slides and learn the content preliminarily before going in. Yeah. So when you go in, you're not learning the content.
Yeah.
You're actually there to absorb the information that can only be gained through the experience of working in the field. Because what we have in medicine is a lot of like essentially lecturers that are very, very very, very senior. They're like they've worked in the industry for like years and years and years. They're like senior consultants, and then they come and lecture about their minutia of like interest for like an hour, and they try to consolidate 30 years of experience into like a half an hour lecture. That's a year a second. And what you're trying to gain from that is not what they're teaching you on the surface, but learning it and going like, oh, this is the things that they gain through experience.
Yeah, absolutely. And I think also one other tip that I think can be applied to all disciplines is, and it's so easy to say on the other side of academia, but it's important to shift our mindset from what's going to be on the exam, do I need to know this or do I not need to know this, to this is the information I'm going to use, whether I use it directly or whether I use the way that I think about this information to help someone. And I think once we kind of shift into that mindset, I think a lot of beautiful things happen with our learning, and we regain that passion that, you know, most likely was tainted in high school when we were trying to get into university and that pressure was on us. Yeah.
Is there anything that you'd like to say to wrap up this episode of Bedside Murmurs? Any pearls of wisdom to impart to our listeners?
I mean, orientating can extend beyond anatomy. You know, it can extend to Google Maps, for example, or like different facets of our life. Start off with what we know, build it, and then go forth. And then also, thank you so much for having me. It was
thank
really
you
great.
for coming on.
Thank you.
We love you, Joyce.
Oh, love you too.
Or maybe a more anatomically correct heart.
No, the anatomically correct
Oh.
one.
Oh.
Yeah, so
I'm so excited.
Yeah, so this is like the ventricles,
Yeah.
right? Because it's a V shape.
Okay.
These are the atrias, and then you just need 2 people. So you guys do it.
Okay.
Put it together.
Okay. Wait,
No, like
No.
on either side, right?
like this.
Yeah. So there you go. That's a 4-chambered heart. Yeah.
Oh my god!
Science.
Wait.
So good.
Oh, that makes
Now that is
Yeah.
that's a new life score right there.
Yeah. I expect to see selfies with this.
New post just dropped.
Yeah.
This is what
absolutely.
makes our
Yeah,
podcast
exactly,
go viral.
100%.
Yeah, absolutely. I hope it does.
I hope so too.
Yeah.
Okay, thank you. And
Thank
see
you
you
so much.
next episode.